The real reason we're here today also is because there's been a long commitment since I started about almost a decade ago, sitting down with Debbie and with you all to make sure that as you all developed this amazing facility for this area, is that we come in as the county and we co-locate and we make sure we bring in the services that we've talked about, not only behavioral health, but also food and programs and workforce programs, food nutrition programs. And then we went through, we had a great discussion about all the other things that we can look at from health services, human services, and others.
Thanks everyone for coming today, and thank you Tina and your crew and James and Johannes for meeting with us and working with us on what we can bring to Cloverdale. One of the primary things with this project is not just our services, but the fact that our community members have to drive out of town to get blood draws, physical therapy, all kinds of services that we can actually bring to Cloverdale in this new facility. And that's part of our relationship with the county, is to bring services up here. And a lot of other services are in the works, and they'll come out as we move along, but those are the primary objectives right now, is to make sure that what we do is we bring services to the community so that our community can stay here instead of having to drive out of town, stop at the gas station, stop at the grocery store. You know, we want to keep our resources local as much as possible, and it's better care for them. So I just really want to thank all of the supporters. I especially want to thank my board. Could you raise your hand and identify yourself? They are the ones behind it all, right? It's been a long journey, but persistence and steadfastness has gotten us to this point. I also want to introduce a couple of our community partners. Senior Center, raise your hand. La Familia Sana, Nuestro Comunidad, CERT, Resilient Cloverdale, city people, raise your hand. All of these people have just come together with us and us with them to bring better continuity of care to our community members and our patients, and to work as a team and maximize our resources, because we live in a resource desert up here. So we're going to change that. All of us are going to change that together and build up Cloverdale.
You know, my wife and I are local business owners. We have 3 young children, and we're so honestly fortunate to have our care be received at Alexander Valley Health. And as such, we, as a family, as well as the board of directors, fully support Alexander Valley in their effort to build this beautiful project. So I'm really, really grateful to kind of see this kind of come along this far. Also, when this project gets built, it's not only going to be a game changer for healthcare in our community, but it's also going to be an economic benefit. There's going to be possibly new jobs coming to the area that are going to be good paying jobs that are going to kind of bring some cohesiveness to our community. So that's an amazing opportunity. Then obviously it's going to be a canvas platform to deliver expanded services, and as well as bring new services to the area that frankly have been just neglected for so long. And I think that that's the amazing part of this. So when this project gets done, it's going to be something that we're all very proud to kind of see come up in the community. And frankly, it's going to have a lasting impact for decades to come.
Hi, Tina Rivera, Director for the Department of Healthcare Services. And I just want to say that Alexander Valley Health and Wellness Center really just puts the focus where it needs to be, and that's on the client. Clients-focused services, and that's what this will do, is just allowing folks here in Cloverdale to be serviced right here in Cloverdale. So I'm really excited to be a part of this project. My colleague was unable to be here. That's Angela Struckman, who's the Director for Human Services. And so we are talking and discussing about what we can do to partner and bring those economic benefit services, mental health services, substance use disorder services, work care development services. What kind of services would benefit the Cloverdale residents so they don't have to travel all the way to Santa Rosa or other parts of the county to get those client-focused services right here in Cloverdale. And so one of the other things that I'm also excited about is that our department, Health Services, will also be able to partner with Alexander Valley in an upcoming grant opportunity. So I'm really excited about being able to do that with Alexander Valley so that we can bring those infrastructure dollars to really lifting this project off the ground. And I also want to recognize Supervisor Gore for leaning into this project, leaning into the Cloverdale community and saying yes and more and what else can we do, and then just bringing us all together and bringing us on board to make this happen. So I just wanted to say that it's really exciting to be a part of this and really focusing on client-centered services. So thank you.
As we've all seen, is fragmented services don't work. What's happening here with the creation of organizations, the different initiatives, we have the most proactive network of community folks that are driving us to do this.
Yes.
So hi, my name's Jade. I'm the executive director of La Familia Sana. We have a space here, right, Debbie?
Yes, you do.
This building for our community health worker work. And so our team, Lisbeth Perez here, she's our community development service specialist, and Mayra Aragui, who's our heart and soul of the organization, who's really the person who's in the community and hearing everything every day. And I just kind of want to talk about some of the things we heard today. Client that needed support at Alexander Valley Healthcare because she had some concerns that she might have cancer. So to be able to pick up the phone and call Berta directly and say, hey, we need to talk to you about this, has been a great resource for us and this community, and it bridges our work together. Same thing with our mental health services. We have a young man who's struggling with his own sexuality right now, and so he's really trying to figure out where his space is in this community, and he's trying to find his own community, and he's trying to bridge the gap between who he is now, and then there's a culture aspect of it, and potentially using our mental health services. So it's all these different ways that we're coming together as a community, that we are pushing the county forward, that we are also bringing in excess resources, because we do know that we have folks in this community who are struggling, who have been in the compost, way out there, right? And people don't know what's going on. And people are working in really tough conditions. So we're happy and we're proud that we're here at this moment, because we do see a path forward. And we know that we see a path forward with everybody here as well. So that's all I have to say. Off the cuff. Thank you.
When I started the nonprofit, my first 6 months was establishing relationships, period. So meeting with Supervisor Gore, some of the other supervisors, other organizations, and just finding out what is everybody doing, what are we doing, and how, as partners, do we complement each other. We have incredible resources sitting right here in this circle. And so community partnerships are essential to providing the community, and then having that feedback loop. We're boots on the ground organization. Familia Sana's boots on the ground organizations. A lot of organizations are boots on the ground. So taking that knowledge from being in community every day, hearing people's stories every day, and communicating it to folks as they're building policy or maybe putting the dollars where they need to be, is informing it so that it all lines up to serve the community. We believe in community-rooted resilience, and that looks different. We started with disaster prep and 911 awareness. They're still our biggest programs. We're now into youth leadership with our Phoenix Rising program. We have health and wellness. We have free Zumba. Just things, because that's what we're hearing. That's what people need. That's the support they need. So it's great to see this. I hadn't seen the renderings. Now I'm even excited times 2, because I think this is going to be amazing. So thank you guys all. This work, I know it's taken years. So thank you for your effort and not letting it go.
Hi, I'm Sandra Coomer, the Executive Director for the Cloverdale Senior Center. And for us, what we're seeing out there is, because of the COVID, there was a lot of isolation for our seniors. Our seniors were challenged with this and not having that support. So what we have for them is we have a holistic way of providing mental health by having activities, whether it's strength training, yoga, that social connection, whether it's a lunch, and also we have like activities. Mental health, we have a grievance. We had one adult, senior adult, that came in and said, I was do here at the Senior Center. We provide that support that's needed out there. Thank you.
Thank you.
Well, I was just going to say, as much as we're sitting all here talking, this is a reality, but a reality that needs our support to build out. So one of the things you talked about is a partnership with us to go after a grant for $500,000. But I know you have folks from your fundraising committee and Kirsten are here or anything. Do you want to talk to us about what we need to drive
Come on.
Raising money?
Yeah.
Buckets at the door, ladies and gentlemen.
Let me run to the car and get a basket.
Yeah, we'll just pass it right now. No, this is a really exciting project. It's not a cheap project, as you can imagine. It's a $40 million project. We are looking for tax-exempt bond funding. We're going to need support in the tune of $5 million to show our participation in this project. So we do have a capital campaign in the works. We're having a lot of conversations, but we need you to spread the word with the community and with major donors, people who are interested in bringing health care to this sorely underserved region. It's an exciting campaign. We really appreciate the supervisor and his team's support on grant opportunities, but also on spreading the word about the fact that we need to raise this $5 million, that's our $5 million philanthropic goal, to get this project built.